The Lewin Study in 2006 is a great resource that you can find online. And so I don't have the current numbers of uninsured, but I think what is important to take away from it is that the bad debt in charity care that represents loss, I believe from 2003 to 2008 was something like $116 million, and this is just hospitals. So
the average loss for the year for all the hospitals?
From 2003, I believe that's the collective loss. I'm looking for my
I think
note.
it was 160, and that's for people that are not paying because they're uninsured or underinsured, and they come into the hospital.
Medicare reimbursements are
or the Medicare reimbursement. It's a mix between the two, but a lot of it's the uninsured people.
Right, so that's the gap, and I think what that universal coverage, so how it's distinct from Prepaid Health Care Act is the Prepaid Health Care Act only takes up a certain percentage of individuals. There's still a percentage that doesn't have care, and so whether you see your commercial rates go up because the commercial plans help to offset the shortfalls in payment of the federal or the state plans, what the universal health coverage or healthcare seeks to do is to expand access and to expand coverage, and so by doing that you at least have some form of payment for services as opposed to having individuals show up that have no coverage.
The question then is, can we do that by legislating that particular gap group without changing all of the other components of which this bill apparently tries to change? Sometimes it's like taking the radiator up and driving a new car underneath it versus, okay, the car needs a tire, it needs a transmission, let's repair those. Is it repairable, Professor?
Well, that's really what the Massachusetts plan is. So in Massachusetts, they require that you must have health insurance. There is a subsidy provided by the state of Massachusetts to help cover, but it's all private plans. And so, you know, the thing is, we're already paying for the people that are uninsured. We're paying through higher premiums, you know, and that $116 million gap that's not being paid is being paid by us. And so by subsidizing, you're just saying, let's do it and let's provide better care because these people actually have insurance now, and they go and get their preventative care, they get appropriate care before they get too sick and have to have emergency room care.
How do they get it in Massachusetts?
In Massachusetts, it's part of your tax. When you file your taxes every year, you actually have to put down where you're, and it's required by law that you have health insurance. So they're at 98% coverage now.
If I may also just bring
Please.
to light.
Yeah, by the way, no one has to wait for me to say anything.
Ask a question.
Jump in.
Sure.
This is not a town hall meeting where you're going to fight, though, right? We already agreed on it.
Sure.
You guys haven't said anything controversial.
Well, I think that there's a general desire to look at how to fix these problems, and they are very challenging problems. And I think that you raise an interesting question about, can you get there from here if you look at fixing the problem areas, focusing on the problem areas. I think what's important for the consumers to understand is the rest of reform includes some of the following things. Discussions about quality of care.
Consumers, she's talking to you now.
So,
where is her camera?
No.
One of these.
So quality of care, and so there are areas like value-based purchasing where they look at ways to be able to gain efficiencies in the system and how purchases are made and being rewarded for the performance. So that, again, it's looking at the same way a business has to take a service and create the service so that you have the optimal outcome. Those are very difficult things to measure, and they're very difficult things for the Congressional Budget Office to score. And as a result of that, it's hard to be able to say how much savings you're going to get. But what we know from within the industry is a payment rendered should result in an optimal outcome. And so I know that at least the providers that we work with are very heavily engaged in those discussions about ensuring that consumers receive quality of care. I think the consumers need to also look at what responsibility that they have when they interact with the healthcare delivery system. So everyone
Those
has
of you out there are smoking right now, she's speaking to you.
And I think efficient utilization of the services. We have a fixed capacity in Hawaii, and so in an emergency department, if someone finds it more convenient, say, to go to an emergency department for something that they might be able to get care for through a scheduled appointment, albeit it might be less convenient, what they need to begin to understand is that utilizes existing capacity when the emergency department staff also needs to be able to care for those that are acutely ill. So what the health reform also seeks to do in discussion is to look at where are there opportunities to gain efficiencies, effective utilization of certain services. And there are frankly some things within Medicare that just don't make sense. They may pay for, let's say for an infusion, they may pay for a patient to receive the service to have the infusion, but then it might not pay for the drug.
What's the word? The fusion?
If you had to go, let's say a cancer patient that wanted to be able to receive their chemotherapy at home, okay. In order to have coverage for that, there are parts that go together to make for that complete service. The person who's going to be there to set up the administration, the medicine that you're going to receive, et cetera. And we have some challenges in that flow of money in what makes sense in how you deliver the care, but the payment for it isn't, it
Carl,
doesn't
let me ask
follow.
you this, and she's ticked one of my buttons on this curative versus preventative health care, because I haven't heard us talk about preventative health care yet. But I know in my own family, my daughter is going for cross country. She's got to get a physical exam. Everybody said that's not covered. Checking up whether your body is okay is not covered. And we talk about preventive medicine, but yet the system is where there's not enough incentives to encourage. Like when Jiffy Lube says, you know, you're 3,000 or 3 months or so many miles, go in and get your thing. Why don't we do the same thing? Now, again, I'm talking very naively commonsensical, but when that kind of basic preventative stuff is not covered, no wonder costs go up, because by the time the cancer is there and all the other stuff that they catch at a late stage, it's almost too late and it's very costly. What's going on in terms of, we give lip service to preventative, but we don't actually produce it?
Sure. We're beginning to see some effort made in that direction. I mean, certainly some delivery systems are really embrace that as part of their whole model. I know Kaiser's system is includes those screening and preventive milestones as part of their usual care for patients.
You can tell I'm not a Kaiser.
And I, you know, again, I'm here to represent,
you represent
you know,
them
a
all,
broad,
right?
of course. That's just one example that came to mind. I know that some of the insurance companies, as a result of this discussion about prevention, has been providing some discounts to their members to go use health clubs. But I think what we've got to look at is, as a healthcare delivery system, we're sort of flipping ourselves to a different way that we look at how we deliver care. So it's been a disease management model.
Yes, that's the curative.
And what we're trying to do, I guess you could say, we're either changing the focus or altering the intensity of the focus, or we're expanding our focus. So we're beginning to look at how, if you implement preventive models within your delivery system, does that, from a business case, actually allow you to have savings in the long run? So you're not necessarily paying for that smaller percentage of individuals that consume the most resources, because you've started earlier to be able to
That's the long-range payoff then.
Right, the long-range payoff.